The Right to Safe Mother and Reproductive Health Act 2075-2018. Date of authentication 2075. 6 to Bill 18 September 2018. Act number 9 of the year 2075-2018, an act made to provide for the right to the safe motherhood and reproductive health. Preamble. Whereas it is expanded to make necessary provision on making motherhood and reproductive health service safe, qualitative, easily available and accessible in order to respect, protect and fulfill the right of safe motherhood and reproductive health of the woman conferred by the Constitution of Nepal. Now, therefore, it acted by the Federal Parliament. Chapter 1 Preliminary. Short title and commencement. This act may be cited is the Right to Safe Motherhood and Reproductive Health Act 2075-2018. This act shall come into force immediately. Definition. Unless the subject or the context otherwise required in this act, emergency obstetric care means the service available 24 hours to manage any complication in case such complication appear during the condition of pregnancy, child delivery or childbirth. B. Basic emergency obstetric care means the basic service such as administering antibiotic, magnesium sulfate or oxytocin, taking out entangled placenta and fetus membrane, give birth to infant with the help of vacuum, and cleansing uterus in the case of occurrence of miscarriage. Teenagers means a person who is of the age group of over 10 years up to 19 years. Teenagers means a person who is of the age group of over 10 years up to the 19 years. Abortion means the act of fetus coming out or taking it out of the womb or before the fetus remain in the uterus born naturally. Contraception. Contraception means the measure to prevent pregnancy by creating obstruction in the common process of ovulation, melting over sperm and ovum or ovum implantation. Contraceptives means hormone-based or other means to help in the work of contraception. Abortion services means the abortion service performed in a licensed health institution by the licensed health worker upon fulfilling the process under this act. Obstetric care means the service referred to in section 5. Pregnancy means a period from the first day of the last menstruation occur prior to conception up to remaining of fetus in the womb of a woman. Prescribed or is prescribed means prescribed or is prescribed in the rule framed under this act. Newborn essential care means the care included keeping the newborn warm, caring of navel and eye breastfeeding, administering necessary vaccines. Newborn emergency care means administering antibiotic, managing including hypothermia for the newborn during the state of infection, and managing the problem relating to respiration of such a newborn. Family planning means the plan to determine number of children or gap between the pregnancy upon self-interest by using or not using the contraceptive. Reproductive health means physical, mental and social health condition related to reproductive system process and function. Right to reproductive health means the right referred to in section 3. Morbidity means the state of adversely affecting reproductive system due to reproduction, pregnancy, abortion, labor and sexual behavior, and this term also include uterus prolapse, tracheal cavity, infertility, pelvic cancer and similar other state of such type that affect the reproductive system. Midwife means a trained health worker to help in childbirth of the pregnant woman. Ministry means the Ministry of Government of Nepal looking after the matter relating to health. Comprehensive emergency obstetric care means blood transmission and surgery service in addition to basic emergency obstetric care mentioned in clause. Safe motherhood means motherhood services to be provided to women pursuant to this act during the state of pregnancy, labor and childbirth. New health institution means a hospital, nursing home and a medical college or health academy operated in governmental, non-governmental, community or private level, and the term also include primary health care center, health post or health institution operated under any other name. Chapter 2 Right to reproductive health. Right to reproductive health. Every woman and teenager shall have the right to obtain education, information, counseling and service relating to the sexual and reproductive health. Every person shall have the right to obtain the service, counseling and information relating to reproductive health. Every woman shall have the right to safe motherhood and reproductive health. Every woman shall have the right to determine the gap between birth and the number of children. Every person shall have the right to get information regarding contraceptive and use them. 5. Every woman shall have the right to obtain abortion service pursuant to this act. 6. Every woman shall have the right to nutritious, balanced diet and physical rest during the condition of pregnancy and childbirth and morbidity. 7. Every woman shall have the right to get necessary counseling, obstetric care and postpartum contraceptive services. 8. Every woman shall have the right to get emergency obstetric care, basic emergency obstetric care, comprehensive emergency obstetric care, essential care for newborn baby and emergency care of newborn baby. 9. Every person shall have the right to get reproductive health services needed during the different situation of his or her life cycle in easily available, acceptable and safe manner. Every person shall have the right to make a choice of reproductive health services for to remain confidential. The reproductive health services obtained by every person and information regarding this shall remain confidential. Chapter 3. Safe motherhood and newborn baby. 5. Right to get basic obstetric services. Every woman shall have the right to get her examined or checked whether she is pregnant or not upon getting to a health institution. The health institution concerned shall have to provide the pregnant woman coming to get services pursuant to subsection 1 with the service as follows: A. To check health at least 4 times during the pregnancy in normal condition. B. To check health as per the advice of physician or competent health worker during the prescribed condition except that referred to in clause. C. To receive the appropriate counseling relating to health care. D. To obtain safety measure and minimum care to be adopted during the pregnancy. 6. To provide obstetric care, or governmental and community health institution providing obstetric care shall have to arrange competent health worker to provide obstetric care or midwife or other trained health worker if such a competent health worker is not available. To the government and non-governmental and private health institution fulfilling the standard prescribed by the government of Nepal shall have to provide obstetric care in a respectful manner. 7. Emergency obstetric and newborn care. The government and the community health institution providing obstetric care shall have to provide obstetric care in a respectful manner. To non-governmental and private health institution fulfilling the standard prescribed by the government of Nepal shall have to provide emergency obstetric and newborn care. 3rd. In case of the health institution referred to in the subsection 1 and 2 are not able to manage the complication that arise while providing service by them, they shall have to refer to a governmental or community health institution to the extent possible and to a non-governmental and private institution if not possible. For it shall be the duty of the health institution concerned to manage the health complication of condition relating to pregnant, childbirth or newborn who come upon being referred pursuant to subsection. The health institution providing emergency obstetric and newborn care shall have to make provision of resting place as prescribed for the pregnant woman of the condition as prescribed at health care of newborn baby. The health institution providing obstetric care shall have to make provision relating to the health care of the newborn baby as per standard prescribed. 9. To maintain a record of the birth of the infants. Each health institution shall have to maintain record of the infant born in that health institution. On the basis of the record referred to in subsection, the health institution shall have to provide the father or mother with the certificate of the infant born in its health institution by standing the name of father or mother of the infant. Each health institution shall have to maintain a record revealing the number of the dead infant and the women who have undergone miscarriage or abortion. For each health institution shall have to maintain a record of dead women, if any, who come for the obstetric care. 10. Right to obtain family planning services. Every person shall have the right to information, make choice relating to family planning and get other services relating to family planning. The service relating to family planning is prescribed shall have to obtain from the health institution is prescribed. 3. Other matter relating to family planning shall be as prescribed. 11. Not to get family planning performed forcefully. It is forbidden to get family planning of anyone performed forcefully by coercing or threatening or intensifying or tempting or without obtaining written consent of such person. 12. Not to get contraceptive use forcefully. It is forbidden to give the contraceptive use by coercing or anyone or threatening or enticing or tempting or without obtaining consent of such person. Right to obstetric leave. Any woman working in governmental, non-governmental or private organization or institution shall have a right to get obstetric leave with pay for a minimum of 98 days before or after the delivery. In case the obstetric leave referred to in subsection it is not sufficient to any pregnant woman, such woman shall have the right to get leave without pay for a maximum of 1 year upon the recommendation of the expert doctor. 3. A governmental, non-governmental or private organization or institution shall have to make necessary arrangement for women working in its office for breastfeeding during the office hour up to 2 years from the birth of the infant. 4. Even if any pregnant woman give birth to a dead infant or if the infant dies after birth, such a woman shall enjoy the leave referred to in the subsection. 5. If the wife of a male employee working in a governmental, non-governmental or private organization or institution is going to deliver a baby, such an employee shall get the obstetric care leave with remuneration for 15 days before or after delivery of the baby. To provide additional leave if complicated surgery is to be conducted is for the opinion of the specialist doctor due to morbidity. The governmental, non-governmental or private organization or institution shall have to provide the woman working in its office with additional leave with pay for a maximum of 30 days before or after conducting such surgery. Chapter 4. Safe abortion. 15. To perform safe abortion, a pregnant woman shall have the right to get safe abortion performed in any of the following circumstances: of fetus gestation up to the 12th week with the consent of the pregnant woman. Fetus gestation up to the 28th weeks is for the consent of such woman after the opinion of the licensed doctor that there may be danger upon the life of the pregnant woman, or her physical or mental health may deteriorate or disable infant may be born in case the abortion is not performed. Fetus gestation remain due to rape or incest. Fetus gestation up to 28 weeks with the consent of the pregnant woman. D. Fetus gestation up to 28 weeks with the consent of the woman who is suffering from HIV or other incurable disease of such nature. Fetus gestation up to the 28 weeks with the consent of the woman is for the opinion of the health worker involved in the treatment that damage may occur in the womb due to defect occur in the fetus gestation, or that there is such defect in fetus of womb that it cannot live even after the birth, that there is a condition of disability in the fetus gestation due to genetic defect or any other causes. 16. Not to get abortion conducted forcibly except in the circumstances is referred to in the section 15. No one shall conduct or get abortion conducted with an intention to get the abortion conducted or knowingly or having reason to believe that abortion can occur. 2. No one shall get the abortion conducted by coercing a pregnant woman, threatening, enticing or tempting her. 3. If any of the following act is committed, it shall be deemed to have not got abortion performed. A. Getting abortion conducted pursuant to subsection 2. B. Miscarriage that occur while something is done to the pregnant woman with some enmity. C. Making assistance to commit act referred to in clauses A and B. 4. While conducting abortion, in case the abortion does not occur instantly but a living infant is born, and if the infant which is born is a result of such an act dies immediately, it shall be deemed to have got the abortion conducted for the purpose of this section. 17. Not to commit abortion upon identifying sex. No one shall commit or cause to be committed an act to identify the sex of the fetus in the womb. To a pregnant woman shall not be pressurized or compelled or intimidated or coerced or enticed or entrapped in undue influence to identify the sex of the fetus. 3. Conducting abortion or causing it to be conducted by identifying the sex pursuant to subsection 1 and 2 is prohibited. 18. Safe abortion services. The licensed health worker who has fulfilled the prescribed standard and qualifications shall have to provide the pregnant woman with the safe abortion service pursuant to section 15 in the licensed health institution. To appropriate technology and process of the service to be provided is referred in subsection 1 shall be prescribed. Third, the pregnant woman who want to obtain the safe abortion service shall have to give consent in the prescribed format to the health institution which has obtained a license, or to the health worker who has obtained a license. 4. Notwithstanding anything contained in subsection 3, in the case of the woman who is an insane, who is not in a condition to give consent instantly, or who has not completed the age of 18 years, her guardian or curator shall have to give consent. 5. Notwithstanding anything contained in subsection 4, in the case of a woman who is below the age of 18 years, safe abortion service shall have to be provided by considering her best interest. to maintain 19 to maintain confidentiality. The licensed health institution or licensed health worker shall have to keep confidential all record information document related to reproductive health of the pregnant woman and counseling and service provided to her, to notwithstanding anything contained in subsection. The record relating to such information document and counseling service may be made available on the following condition: A. If the information is demanded by the investigation authority or court in course of investigation and hearing of any lawsuit. B. If it is required to court without revealing identity of the related woman for the purpose of study, research or monitoring relating to self-abortion. C. If the woman concerned demand herself the record thereof. Chapter 5 Morbidity. 20. Right to obtain morbidity care. Every woman shall have the right to get her examined, obtain counseling and receive treatment relating to morbidity by or in the health institution. 2. It shall be the duty of concerned health institution or health worker to provide information of the matter relating to the care to be followed on the condition of morbidity and in the condition following the surgery and the hazard likely to be caused by it while providing service referred to in subsection in a manner that such information is understandable. 21. Not to displace. No one shall divorce, expel from home or displace anyone or get anyone divorced, expel or displaced by showing the reason of morbidity. Chapter 6 Budget Appropriation and Grant for Motherhood and Reproductive Health. 22. To appropriate grant amount, the government of Nepal shall have to appropriate grant amount through its budget every year for every local level for the purpose of motherhood and reproductive health services. 2. The provincial government shall have to appropriate certain amount through its budget as grant every day as per the provincial law for the local level for the purpose of motherhood and reproductive health services. 3. The local level concerned shall have to spend the amount appropriate as per the subsection 1 and 2 for the motherhood and reproductive health of the economically extremely destitute woman as per prescribed. 23. To appropriate budget by local level. First, the local level shall have to appropriate necessary budget from its annual budget for the purpose of motherhood and reproductive health services. 2. While appropriating budget as referred to in subsection, it shall have to be appropriated in such a way that governmental and community health institutions providing safe motherhood and reproductive health services received it. 24. Reproductive Health Coordination Committee. In order to make necessary suggestion to the Government of Nepal for preparing policy plan and program relating to safe motherhood and reproductive health, there shall be one Reproductive Health Coordination Committee as follow: A. Secretary, Ministry of Health and Population Chairperson. B. Joint Secretary, Ministry of Women, Children and Senior Citizen Member. C. Joint Secretary, Ministry of Education, Science and Technology Member. D. Director General, Department of Health Service Member. E. Representative, Nepal Medical Council Member. F. Representative, Nepal Nursing Council Member. D. G. Representative, Nepal Health Professional Council Member. S. Legal Officer, Ministry of Health and Population Member. I. 2 representative, including one woman nominated by the Ministry from among the professional institution person conducting studies and research or extending services in the field of reproductive health and right to reproduction member. J. 1 representative of Nepal Health Volunteer Association designed by the ministry member. K. Director, Family Welfare Division, Health Service Department Member Secretary. To the coordination committee may invite the expert engaged in the sector of reproductive health and right to reproduction to the meeting as required. Third, the procedure relating to the meeting of the committee shall be as determined by the committee itself. Chapter 7 Offence and Punishment. Of 25. Offence remand deemed to have been committed. If one commit any of the following act, one shall be deemed to have been committed the offence under this act. A. To deprive one of the receiving the obstructive care referred to in section 5. B. Refusal to provide obstructive care by any health institution providing obstructive care pursuant to section 6. C. Refer to other health institution deliberately even upon the treatment being possible in his or her health institution or the non-issuance of birth certificate by the health institution pursuant to section 9. E. Forceful conduction of family planning is referred to in section 11. F. making a forceful use of contraceptive is referred to in section 12. The conduction of abortion is referred to in section 16 as commission of any act to identify sex of the fetus in contrary with the provision of subsection 1 and 2 and of the section 17. I causing abortion upon identifying sex is referred to in subsection 3 of the section 17. The breaching or causing to be breached of confidentiality in contravention of the provision of subsection 2 of section 19. K. Making or causing to be made in displacement in contrary to the provision of section 21. KL. Making discrimination contrary to provision of section 29. 26. Punishment if one commit or cause to be committed by any act. This is deemed to be the offence is referred to in section 15. One shall be liable to the following punishment according to the gravity of the offence. A. Imprisonment for a term not exceeding 6 months or fine not exceeding 50,000 rupees or both the penalties for committing or getting committed the offence referred to in clause A, B, C, D, L. B. Imprisonment for 3 months to 6 months and fine not exceeding 50,000 rupees for committing or getting committed to the offence referred to in clause E and F. Punishment referred to in section 188 of National Criminal Code 2017 for committing or causing to be committed the offence referred to in clause GHI. The fine not exceeding 50,000 rupees for committing or causing to be committed the offence is referred to in clause A. Imprisonment for a term not exceeding 1 year and fine not exceeding 100,000 rupees are both the penalties for committing or causing to be committed the offence referred to in clause K. 27. Provision of compensation. A person who is victimized for the offence under this act shall be provided with reasonable compensation by the perpetrator. Chapter 8 Miscellaneous. 28. To provide disability friendly services while providing services including family planning, reproductive health, safe motherhood, safe abortion, emergency obstetric and newborn care, morbidity under this act, such services shall have to be adolescents and disability friendly. 29. Not to discriminate. No one shall discriminate on the right to get monthly services including family planning, reproductive health, safe motherhood, safe abortion, emergency obstetric and newborn care, morbidity on the ground of one origin, religion, color, caste, ethnicity, sex, community, occupation, business, sexual and gender identity, physical or health condition, disability, marital status, pregnancy, ideology, state of being infected with or vulnerable to any disease or germ, state of morbidity, personal relationship or any other similar ground. 30. Provision of protection home. For the protection of reproductive health of the woman who is mentally disabled, neglected from the house, family or relative or raped, the federal, provincial and local level shall have to make arrangement with reciprocal coordination for keeping such women in a protection home. 31. To give directives. The ministry may give necessary directive to the health institution to provide safe provide service of reproductive health. To it shall be duty of concerned health institution to comply with the directive received pursuant to subsection 1. 32. Service charge. The government health institution or health institution that receive government grant shall have to provide free reproductive health services to private, non-governmental and community health institution may take service charge is prescribed for providing reproductive health services. 3. Notwithstanding anything contained in subsection 2, private, non-governmental and community health institution and health workers shall have to make the service easily available and provide free services. Quota is prescribed for the person who is unable to pay the service charge. 32. Obstructive allowance. The government of Nepal shall have to provide the extremely destitute women who deliver baby with obstructive allowance is prescribed. 34. Saving of act done in good faith. Notwithstanding anything contained elsewhere in the act, no legal action shall be instituted against any health institution and health worker for any matter of reproductive health service provided in good faith. 35. Authority to try cases. The concerned district court shall have the authority to originally to adjudicate the case of the offence under this act. A person who is not satisfied with the punishment or order made by the district court pursuant to subsection may make an appeal in the concerned High Court. 36. Government of Nepal to become plaintiff. The Government of Nepal shall become the plaintiff in the cases referred to in section 25. The cases referred to in section 25 shall be deemed to have been included in section 1 of the National Criminal Procedure Code 2017. 37. Limitation. No complaint shall lie after the expiry of 6 months from the date of knowledge of the commission of any offence under this act. 30. To be in accordance with the prevailing law, the matter contained in this act shall be governed by this act, and the matter not contained in this act shall be in accordance with the prevailing law. 39. Power to frame rule. The Government of Nepal may frame necessary rule in order to implement this act. 42. Issue directive. The Ministry may frame and implement the necessary directive subject to this act and the rule frame under this act. Thank you so much.